Across the globe, justice systems are being reimagined through trauma-informed care, desistance theory, and neuroscience. At the forefront of this movement stands a voice for change, a trainer of professionals, and a storyteller committed to evidence-based reform. This is The Criminologist, the podcast exploring the people, the practices, and the possibilities shaping a more humane justice system. And now, please welcome the host of The Criminologist, Joseph Arvidsson.
Hello and welcome to episode 241 of The Criminologist Podcast. Happy to have you all with us today. In this episode, we welcome back a familiar voice to the podcast, Dr. Jerrod Brown. Many of you know Jerrod from his previous appearances on the show, where we've explored topics such as trauma, neurodevelopmental disorders, fetal alcohol spectrum disorder, traumatic brain injury, executive functioning, confabulation, suggestibility, and the many ways brain-based differences can impact justice-involved individuals. And today, we are going to explore a topic that may sound at first a bit unexpected. Lego-based interventions with justice-involved populations. Now, I know some listeners may hear that and think, Lego bricks? In probation? In corrections? In forensic mental health? Really? But stay with us, because the deeper we get into this conversation, the more it becomes clear that this is not about toys. It's about responsivity. It's about engagement. It's about making abstract concepts concrete. It's about giving people a hands-on, structured, non-threatening way to practice skills that are often very difficult to teach through conversation alone. Skills like communication, problem solving, perspective taking, emotional regulation, frustration tolerance, planning, following directions, working with others, and maybe just as importantly, experience mastery in a setting where many justice-involved individuals have experienced repeated failure, shame, exclusion, and misunderstanding. One of the major themes Jerrod has helped us understand over the years is that many people who become involved in the criminal justice system are also living with some form of neurodisability or cognitive challenge. That may include FASD, traumatic brain injury, dyslexia, autism-related needs, learning disabilities, executive functioning deficits, attention and memory challenges, language processing difficulties, or other barriers that make traditional talk-based interventions much harder to access. And when we miss those realities, we can misread the person. We can interpret confusion as resistance. We can interpret poor memory as dishonesty. We can interpret difficulty following instructions as defiance. We can interpret emotional dysregulation as simply, quote, bad behavior, unquote. And when that happens, we are no longer practicing good responsivity. We are asking people to benefit from interventions that may not be designed in a way their brain can actually use. And that is why today's conversation matters. Lego-based interventions offer one possible way to rethink how we engage with clients, especially those who struggle with verbal processing, attention, planning, memory, impulse control, or social communication. The goal is not to replace evidence-based practice. The goal is to ask a better question. How do we make evidence-based practice more accessible? How do we help people practice real skills in real time? How do we create safe, structured opportunities for learning? And how do we meet people in ways that are developmentally appropriate, trauma-informed, and strength-based? For me, this conversation connects directly to the risk-need responsivity framework. Risk tells us who to prioritize. Need tells us what to target. But responsivity reminds us that how we delve into an intervention matters deeply. If the method does not fit the learner, we should not be surprised when the intervention does not stick. So, today, Jerrod and I will talk about neurodisability in the criminal justice system, why hands-on interventions may be more powerful than they first appear, how Lego-based interventions can build practical skills, how this connects to responsivity, and what agencies should consider if they want to explore this kind of work in a thoughtful and ethical way. As always with Jerrod, I expect this conversation to be wide-ranging, practical, and full of insights that challenge us to think differently about the people we serve and the methods we use. So, sit back, enjoy my conversation with Dr. Jerrod Brown, and I'll see you all on the other side. Well, welcome back to the show, Jerrod, a long-time contributor to The Criminologist. We appreciate you. We're going to talk today about a fascinating topic that I think the audience will appreciate as well. Jerrod is going to talk to you all about an innovative and novel approach he has taken, leveraging the use of Legos in a variety of applications. I don't want to steal your thunder too much, Jerrod, so let's dive into it. But before we really get into the use of Lego-based interventions or Lego-based activities, I know that when you talk about this, you sort of lay the groundwork by talking about the prevalence of neurodisabilities in the criminal justice system, which I don't think the practitioners, much less the public, are as aware of they should be with this phenomenon. So why did you feel that was an essential starting point? And to my contention, what do probation officers, parole officers, corrections officials, and even treatment professionals often miss when it comes to neurodisability not being properly understood?
Yeah, Joe, thanks for having me back, my friend. And how does neurodisability really factor into what we're going to be talking about today? Well, that's kind of how I got started with really digging into the use of Lego building bricks as a skills building tool. And also often I consult on cases involving a client with a neurodevelopmental disorder or a neurodisability. And a lot of times clients with some of these kind of neuro-based deficits, once they get involved in the justice system, really struggle with traditional interventions because of the fact of executive function impairments, abstract reasoning deficits, learning challenges, comprehension deficits. A lot of times folks with a neurodisability may lack insight into their own awareness around the fact that maybe they do need a little extra help, extra support, but their brain tells them no, they don't. But in all reality, yes, they do. And when you study neurodisabilities, or whatever term you want to call it, neurodisabilities, sometimes people talk about the term neurodivergence, which is very important to be aware of. If you're working with someone with a neurodisability involved in the justice system, there's many disorders that could fall under that umbrella, like ADHD, FASD, a traumatic brain injury, Wernicke-Korsakoff syndrome. It's a broad term. Every client is different. The client is not their label, so I want to make sure people know that. But when you're working with folks with some of these neurodisabilities, social communication deficits, very, very common. learning, attention, memory, cognition-related issues, problems with staying organized and using time effectively and planning and all of those things. And if we don't modify our approaches to work with folks with these backgrounds, again, traditional forms of sentencing, management, supervision, probation, court-ordered treatment, a lot of times falls short. And also often these clients end up violating probation, parole because of technical violations. And then it's that revolving door. They're in and out of jail, prison, courts, mental health courts, all that stuff. And that's kind of a big reason why I've been studying Lego-based approaches and puzzle therapy and all these creative interventions. I'm not saying change what we're doing in the criminal justice system, continue to do all the great work all of you are doing, but are there some other interventions that we can incorporate into what we're doing that may help the information you're teaching some clients stick more and help that client retain it more? And that's kind of how Legos fall into that equation, because Legos can be a really good visual 3D teaching tool. And I'll talk about what that means and how I really got into this probably about 5 years now at this point. So, Joe, I can go a lot deeper into that if you want, but that would be a really quick overview.
Yeah, that was amazing. Thank you. As I listened to you, it reminded me of, well, a couple of things. One, that when I was a practicing probation officer, I was in the dark as to everything you just noted about the propensity of this phenomenon amongst justice impacted individuals. It in fact reminded me of the paper that you and I wrote, Jerrod, on FASD and overlaying that within the risk needs responsivity model. And we really went down the assessment rabbit hole, but it's a good reminder. And I will, in fact, attach that paper to the show notes of this episode so folks can learn a little bit about that. But thank you for that foundation. I should note that in preparation for this interview, you did supply me with an amazing PowerPoint deck on this topic. And when I reviewed the deck, I pulled out 4 or 5 different themes that I think would make a great foundation for the interview. And one of the first themes that I came across was how your work on utilizing Legos it's this notion that Lego activities can create a non-threatening, structured, hands-on way for practitioners to engage their clients. Now, for the viewer or listener out there who may be initially thinking, Lego bricks? Really, Jerrod? Help us understand why this can be such a powerful intervention tool.
I started studying this topic, I think 5.5 years ago, and I came into contact with this topic because I do a lot of work in the area of autism. And I came across an article one day about the use of Lego bricks with folks with autism. And I was like, oh, that's interesting. I love Legos growing up. So I started digging into it, didn't realize, geez Louise, there's tons of articles, empirically based and non-empirically based articles that talked about the use of using Lego bricks as a therapeutic tool to help folks with autism. So I started Googling, found a couple online training programs out of the UK, and I ended up doing those programs. Very great programs. Both those programs, phenomenal, learned a ton. None of those programs had anything to do with justice-involved populations. So over the past few years, I've been really digging into how could we use the science of Lego building blocks and infuse it with justice-involved populations. And I've been going on podcasts now talking about this. I've developed some trainings, and to me, it's a no-brainer because if you really dig into the literature on the use of Lego building bricks, basically what it says is, like you said, Joe, it's a visual 3D tool. It's very tangible. And for clients, some clients, like for example, a lot of clients you guys work with probably have abstract reasoning deficits, which means if they go to therapy and that therapist asks questions about why do you feel this way? How do you feel this way? Connecting the dots for some clients with brain-based impairments can be very, very tricky. So talk therapy in and of itself might not be that effective, but how do you make it more effective? Bring in a bucket of Legos, have a person put it together while you're talking. It's a great icebreaker. It's free. You'd obviously want to have training on this and know the literature and all of that good stuff. But the literature indicates if you use it effectively, it can really address real world problems. And there's different modalities out there. If you were to do this from a therapy standpoint and you Google like Lego therapy, that would indicate you'd probably be like a licensed therapist. You've had training. Now, if you're a probation officer and you want to use this, skills building, coaching, modeling, teaching, no problem there. It's a practical hands-on way to help clients visualize something. You could help clients visualize something that's not going well for them. You could help them visualize something that's going well. There's a multitude of ways to make this practical. One way to make it practical, maybe you meet your client for the first time and you need a good icebreaker and you know that client doesn't like to talk, or you're just stuck and that client just is really shy or afraid. Well, the research says have a bucket of Legos in there. Maybe ask the client, do you like Legos? And you might find, oh, I love Legos. Have the client snap some Legos together as you're talking. It helps distract. It helps the client open up more. If you were to use this as a skills building resource, you could have a group. You could do it one-on-one, and it's a great communication tool. It's a great way for clients who struggle with naming their emotions to maybe visualize their emotions by building something that is about something going on in their life right now. And you could have a theme. Maybe you find out the client really likes a certain movie, or like Star Wars, for example, and you have the client build something that's really important to them, and then they share about it. What does that do? Well, it helps with communication. It helps with turn taking. It could help with problem solving. It could be a great way to externalize anxiety and help the client get out of themselves and then visualize it. It's a very simple 3D visual tool that's typically non-invasive. It's hands-on. So when you're using your hands too, what are you doing? You're working on fine motor skills. For young kids, there are occupational therapists that use this to help build strength in the upper body for kids. There's a lot of different avenues that people can use with this, but I think it's a valuable resource that's not tapped into a lot. And it can also be a really nice educational tool as well. So if we can get clients to start learning new things and start thinking about the future and having a growth mindset and taking up a hobby too, that's good for brain development. That's good for all kinds of different things. Joe, I'll definitely go a lot deeper into this, but if you were to look at the Lego literature, very little has been done on this with justice-involved populations. But if you look at this literature, many studies have shown that the use of Lego building bricks as a therapeutic tool or skills building tool has been used in autism treatment. I have articles that have shown that this can be helpful for clients with dyslexia, for clients with ADHD, people with traumatic brain injuries. Now, those articles don't talk about forensic types of topics, criminal justice, but we know from the literature, half of people in prison have a brain injury. Maybe 40 to 60% of people in prison have undiagnosed dyslexia. 10 to 25% of your caseload right now, probably you're working with someone with undiagnosed fetal alcohol spectrum disorder. So it can be used. I think it can complement the good work you're doing. And I'll give some more practical examples in just a minute, Joe.
Well, you did a great job already getting into the sort of real world skill development that probation officers of the 21st century should be endeavoring to do. We're operating, as I mentioned, under the risk needs responsivity model. We know a lot of that model is predicated on effective use of cognitive behavioral interventions. And again, when I was reviewing the literature on this and I talked or when you rather talked about how these Lego-based interventions can be used to build real skills, I created a short list here and I thought, okay, this is right out of my old playbook as a probation officer. Skill development to support communication, emotional regulation, social perspective taking, problem solving. I mean, that's a go-to in COG skills, teaching problem solving, treatment engagement, symptom management. So maybe consider some of those and put yourself in the shoes of a well-intentioned probation officer who is endeavoring to do these, and maybe do an overlay on, how Lego-based interventions can help you augment some of your approaches to get at some of the skill development targets.
Yeah, so one area to think about is cognition. So a lot of clients in the justice system have cognitive-based impairments. So when you hear me talk about the term cognition, memory, learning, language, executive function capabilities, if you know the forensic legal literature, criminal justice literature, many of your clients right now are dealing with deficits in those areas. There are articles in the Lego-based intervention literature that talk about if you use Lego building bricks as a tool, it can really help enhance cognitive skills in your clients. And how does it do that? You'll see some of the slides that I sent Joe, but how could it help promote cognitive skill development? Well, if you have a bucket of Legos, maybe you have the client lay out all the Legos on a table, and then you ask the client, well, let's start identifying the Legos by shapes, sizes, and colors. That's using the brain to organize. You're teaching organizational skills as well. Maybe then, and there's so many ways to do this, you ask the client, okay, let's create something by giving them a specific instruction. By maybe, let's build a house out of Legos. You start with the foundation. So that's the largest part that they build. So they're starting to visualize and strategize. All these skills can help with generalization of information. So they learn it in one setting. The goal would be they take these skills and they can now use it on the job, in school, or at home, or wherever. Maybe you have a visual picture up on your wall, and this is another way you could do it. You have Legos laid out. Okay, here's a picture. Here's a theme. Let's look at that picture and let's try to build as close as possible to that picture. So their hand-eye coordination, using visual cues, all of those things. They're learning counting, which is good. Maybe this would be a good way for someone that has some learning problems to maybe strengthen some skills. They're learning sorting skills. They're learning how to follow directions. And they're also learning how to stay organized, and then learning the importance of cleaning up after themselves. And all these skills could be really good for independent living and all kinds of things like that. The problem solving, absolutely. In the slides Joe will show you, there are articles that I have cited that do show if you work with clients with a lot of internal turmoil, anxiety, worry, fear, depression, and loneliness, forming a Lego club, forming a group or one-on-one and using Lego bricks is a good way to externalize those emotions and can help the client share with you what they're feeling. So those are some really just practical ways to do this. And the nice thing is, this is a structured way and an unstructured way to create safety with the clients. And maybe some clients you have are very perfectionistic and they struggle with making mistakes. This is a great opportunity to use Lego building blocks to help model to the client it's okay to not be perfect. And if you can teach that skill that you don't have to be perfect, that might be a great way to reduce shame and build self-esteem. Maybe your clients never had too many successes in their life. And by learning how to build something and then show it and then articulate it, that can be a great way to celebrate success and help build confidence in your clients. Maybe your client really struggles with working on a team or knowing how to share or give or take. Have a group. Everybody in the group would have a different role, and you're learning leadership skills. You're learning sharing. You're learning collaboration. What is that good for? Well, everything. If the client is really struggling with finding and keeping a job, this would be a great way to teach some of those practical skills that could be used in finding and keeping a job as well. So the list goes on, Joe. I can give many more examples if you'd like.
No, these are amazing. I was thinking, as a quick aside, Jerrod, I'm projecting this into practical applications, and I'm just wondering if I could get your opinion on this. But you and I have talked many times on a variety of topics, and oftentimes when we sort of map out our, utopian world of what systems can become, we've commented on how, ironically, correctional facilities have a lot of control over things that we're contending make a difference, such as diet or the amount of sleep or the amount of structured activity, right? In a correctional facility, administrations control that. I was just thinking when you were speaking about how it might be, well, I shouldn't get ahead of myself. Do you consider applications of this in, for example, a juvenile detention facility where leadership has control over setting up kind of what you're articulating here, Jerrod, versus, say, for example, a one-on-one probation officer attempting to use Lego-based activities?
Yeah, I think you could do both. Obviously, now, when you're doing this in a confinement setting, obviously there's some safety considerations you'd always want to take into account. Like if someone has a tendency to swallow things, you want to be aware of that variable. You want to be aware that sometimes the edge of those pieces could be a little sharp. So if someone has a tendency to engage in self-injurious behavior, so those are things you'd want to be aware of, because not every client might be appropriate for this. And in some cases, maybe you might want to consider not using the small Lego bricks, but use the really big ones that are more easily accounted for, where you can still teach those skills. So really know your audience, know the limitations of this as well. And that's why training would be good and working with people that know this stuff. But in theory, if you have the right group, and if it's in a juvenile detention center, it would be a phenomenal way, if we can account for those safety concerns, to really teach skills. And we know from the research literature that most people in a juvenile detention or adult attention center also have histories of trauma and a lot of times attachment problems. And in the slides, Joe, I sent you, I have a couple articles and slides that were dedicated to trauma-informed approaches using this. And the research on this says the use of Lego building blocks pairs very, very nicely with trauma-informed care principles, which makes sense because typically Legos are safe. People have good memories with them. Not everyone will. It really is something to consider if you're working with clients with histories of prenatal trauma, adverse childhood experiences, disrupted attachment patterns, kids in foster care. It really aligns nicely, and it helps maybe externalize the problem easier. And it might help with some people that may not feel comfortable talking about their trauma in traditional talk therapy. This might be a really safe way to start externalizing those problems, articulating what's going on from a trauma-informed care lens. And feel free to share those slides that I shared with you if that's helpful. And I've been working on a whole nother program right now called Trauma-Informed Brick Play, where it's basically taking the science of Legos, merging it with neuroscience, play therapy, and trauma-informed and attachment theory. And basically, in a nutshell, it shows that it really can help promote a sense of agency, empowerment, belonging, and recovery through that trauma-informed care lens. I do a lot of work in the area of FASD, and a lot of people with FASD really struggle with abstract reasoning and connecting the dots. Most people I've asked who have FASD, when I say, do you like Legos? They say, I love them. And in the slides I sent you, I did put a case study in there too of an actual case I consulted on where I asked the client that very thing. And I put in there what the client actually said. There were 13 different variables to take into account. In the slides I sent you too, Joe, I do a lot of work in the area of autism, and more people with autism are coming into contact with the justice system for a variety of reasons. I'm not saying for like perpetration of crime in all cases, but for vulnerability and victimization things too. And I have an example of a case I consulted on as well, where I asked the individual who has autism, what do you think of Legos? How has Legos helped you? And I put a long list of things together where this person said it really helped me develop more patience. It helped me complete projects and stick with something. This client had a lot of attention issues, and the person said playing with Legos helped me focus more. It helped me reduce my rumination and worry about the future. It really got me out of my comfort zone, and I learned some skills on how to follow instructions more effectively. So it's a very tangible way, again, of teaching very concrete skills to some clients that may struggle with traditional interventions.
The other big theme that I pulled from your material, Jerrod, was this is really all about responsivity. And we've been talking about the risk-need responsivity framework. But when you consider the responsivity principle, this really broadens that responsivity lens, if you will, and ask the practitioner to take into account a lot of these neurodivergent things you've been talking about. And you reminded me in your material, just the sheer prevalence of these things. We've been talking about them for this entire interview, but FASD, traumatic brain injury, dyslexia, autism-related needs, learning disabilities, executive functioning deficits, and metacognition challenges. And again, my takeaway was Lego-based activities can reduce the reliance on verbal disclosure and support visual learning, which will provide structure and offer an alternative when verbal interventions fall short. I think that's one thing the field really doesn't understand. There's an over-reliance or an over-assumption on, well, I told my clients this. I told them this verbally. I don't understand why that form of communication didn't work. But I think that's what I'm saying with the responsivity stuff is you need to communicate effectively. You need to create a safe learning space. And I really do think you're onto something here, Jerrod, with using Legos as an alternative when our traditional verbal instructions are going to come up short.
And a lot of clients, I'm not saying all, but a lot of clients that fit that profile that you just listed off are more hands-on learning. And they like being busy with their hands, moving, going for walks, things like that. And using Legos is a great hands-on learning tool where clients may not always have the words to articulate what they're feeling, but maybe using Legos or other products like that allows them to connect the dots more in their brain, make sense of the world, and then have the intervention stick more effectively. So if you were to do a traditional like cog skills group, typically clients with some of these neurodisabilities are going to have those abstract reasoning deficits and the verbal communication, the processing speed weaknesses, where you really need to tailor that group. And how could you tailor it? Well, really learn about how you can infuse what we're talking about today to make it hands-on and visual rather than relying on traditional verbal-based approaches, lecture formats, hands-on things. And if you have a group too, and you have that group fill out forms or pass out a form, here's a form, folks. We're gonna work on this and have everybody read it. What happens if half your group has an undiagnosed learning disability? Looking and reading that form could be so overwhelming and trauma triggering. That client becomes so dysregulated and storms out of there, where you're thinking as the professional, well, that client's just being willful, malicious, and doesn't want to be here. when in fact there's some sort of brain-based impairment getting in the way of success. Another reason why maybe implementing these approaches into the work you do would only complement what you're doing, not replacing it, but just complementing it.
Jerrod, let's make this a little bit practical for the listener or viewer. So if there's a probation agency, a correctional program, maybe a forensic mental health team, or even a community provider that's just thinking about experimenting with some of these Lego-based interventions, Lego-based activities, use of Lego bricks, where do they start and what do they think about in terms of, we've touched on this a little bit with the juvenile detention question, but, things around structure, safety, facilitation, what does some real world application look like? Maybe some starter tips, Jerrod.
Let's say today is the first time you've ever heard this discussion about how could we do this with the justice system? Use this as a starting point. Reach out to me, shoot me an email. I'll give you a long list of articles, links to read, some other trainings I've done. And then decide, hey, do you want to start a club, a group? What's your focus? Is it skills building? Is it maybe you're a therapist? Is it therapy? Really know what you're trying to do. Is it one-on-one with clients? Is it groups? Is it what's your target population? What's your intended goals? So get all that out on paper. And then at that point, out to a consultant, come in, have someone train you, lay it out, because there's a lot of things to consider, especially when we're talking about justice involved populations. And maybe you have a group and it's focused on emotions. Okay, well, you need to know some of the intricacies of that. Maybe you want to start a trauma-informed care group. You're going to not want to know trauma-informed care. Maybe you're just focusing on one particular area of some sort of problem group. Well, define it, how you're going to do it, have the facilitators trained, develop a marketing brochure that clearly outlines what you're trying to do. And the nice thing about doing this, there's not one right way to do this. You can individualize it to your population. Is it an online group? Is it face-to-face? Maybe you work with families. There's all kinds of good protocols about maybe you're a family worker and you're working with at-risk families. You can actually introduce this into the work you do with families to teach families how to communicate more effectively with one another. So those would be a few starting points. And then at that point, make sure your facilitator's trained. Set up some guidelines and rules for the group, because if it's a group, you'd really want to have rules in place that everyone follows. It doesn't have to be overly rigid by any stretch, but we need to kind of outline, well, this is a 6-week group. It's going to meet once a week for 45 minutes. We really want to define everything clearly. And then a practical way, let's pretend you start a group. Here's might be a really good way to do it. Well, maybe you do an 8-week group, one time a week for an hour. The group is divided by the first 10 minutes of that group is an icebreaker. Everybody comes in, they have a bucket of Legos, and you give everyone 10 minutes. All right, build something, whatever's on your mind today. No right or wrong. In 10 minutes, then everybody will share with the group what they just built, what they're feeling. And then that maybe takes 25, 30 minutes. And then the last 10 or 15 minutes of the group, you kind of have almost a decompression where people build something that's happy to them. You visualize something that's positive, and then that's your group. Or you could have a theme night. Maybe you have a theme. It's all about building something around success. Or it's building around something where you felt like you could have done better at. And then you talk about it. So there's so many ways to do this. There's no right or wrong. I have many slides I didn't share with you, Joe, like how to set this up in a therapy practice, how to set it up in a school, how to set it up in a community, how to do it one-on-one, how to do it with a group. So that, I know it doesn't answer the question directly, but those would be a few basic starting points. But I would definitely stress before anyone does this, make sure you get some training, really know this literature, because it's not as simple as starting a group and running with it. Because what happens if it's a group of trauma? survivors. You don't want to trigger people. There's some downfalls to this too that you need to be aware of.
I'm confident, Jerrod, someone out there is listening, wondering, well, Dr. Brown, can you yourself provide that training? Are there resources, or are you yourself a resource, Jerrod, for the aforementioned training?
Yeah, I would be a fine resource. I never want to try to market myself, but reach out. Definitely, I've been doing more trainings for more groups on this. I've done trainings for mental health providers now on this, occupational therapists, some criminal justice professionals. So it'd be tailored to each group. And yeah, reach out. We can talk through things. And, Joe, on the slides I sent you too, and maybe a safe group would be, how do you use this as a resilience building group? We all do well, whoever we are, building resilience. The higher level of resilience we have, it's like a force field. We can bounce back from tough stuff more effectively. And maybe you're asking yourself, well, I want to introduce this into my organization, and I want to build a stronger team. This can be used not just with clients, but it can be used with professional team development, communication, leadership, management. So it can be applied to really virtually any setting. And Joe, I will say this too. Let's pretend, folks, your client, your organization wants nothing to do with Legos. For some reason, this topic you have no interest in it. The clients you work with don't want anything to do with this. Well, what would be a plan B? Jigsaw puzzles could be another plan B. I'm doing more work in that area too, where there's some really interesting literature that talks about the therapeutic benefits of using jigsaw puzzles to teach similar skills. And in the slides I sent you, Joe, feel free to use them how you'd like, but who hasn't put a jigsaw puzzle together at some point? Jigsaw puzzles can be fun, educational. It can be great for clients who are low functioning, high functioning. Maybe a client really likes digital puzzles, so you can use digital platforms as well. I'm actually putting together a talk for a different group on the use of puzzle play from a trauma-informed care lens, and how can we also infuse that into the work with justice-involved populations. And if you look at some of the literature on the neuroscience world as it relates to puzzles, it says it can help improve memory and focus. It can reduce stress and anxiety. I think it's a great plan B, or maybe it's a plan A. I look at puzzles too. There's some really good, interesting literature out there on that as well.
Jerrod, I'm so glad you mentioned using this amongst or within the agencies themselves. I'm a big proponent of, I often refer to the parallel process, that a lot of the approaches and interventions and whatnot that we promote on this program for clients are just as applicable to us ourselves. So I thought, as you were speaking, boy, what a great way to get past maybe some of the bias or resistance to using Legos with clients, is to start by saying, no, we're going to do this within the agency ourselves and see how it affects us. Just as, for example, when we train motivational interviewing, among other core correctional skills, the practitioners learn, well, I use this with my family and my partner and my coworkers. It's this sort of universal, there's no them, there's only us. But I think it really helps sell it if the practitioner realizes that this new approach, it's effective because it worked with me and my teammates. It worked with me and my boss or whomever. So yeah, thank you for throwing that out there, Jerrod.
Love what you just said, Joe. In the slides I sent you, I don't know if you could share with the group the two slides I have in there on collective intelligence. That goes to the heart of what was said. And collective intelligence is basically focused on addressing complex issues in a team building standpoint. So a team that has high levels of collective intelligence typically has greater group cohesion, better decision-making, better problem-solving abilities. They can come up with more innovation. And collective intelligence and emotional intelligence kind of go hand in hand. So if your team can use this in a skills building standpoint, what are you doing? You're building your organizational's emotional intelligence and collective intelligence. And in theory, if that happens, what happens to your team? Happier, healthier. They trust each other more. They probably don't call in the sick as much. Burnout goes down and there's less turnover. And then when your team is healthier, ethical decision-making goes up. You're more attuned to the clients you work with, and it just leads to better outcomes. Your team has a better reputation. It's a win-win all around. So using Legos in there, I think, would be a great way to help. I am a huge introvert. So in team meetings, I am a quiet person. I know if I'm busy with my hands and had Legos in my hands, I would probably have less anxiety and worry, and I would probably be one to speak up more. So this is great for a team where you have teammates maybe who are very quiet and you know they have a lot to say. Try Legos. It might help open up the conversation in there among people who don't usually speak up and have a lot to say that can be beneficial to the entire group as well.
Jerrod, we've both been referencing this amazing PowerPoint deck that you've assembled. And so for clarity, I should point out, if you're listening to this via the traditional podcast, I am also planning on releasing a companion YouTube video episode. And the YouTube iteration of this conversation will have select PowerPoint slides inserted as an overlay to augment this amazing conversation that Jerrod and I are having. So if you're listening to the podcast, it's motivation to track down the YouTube. And of course, if you're already watching on YouTube, then you're aware of what I'm talking about. Jerrod, I'll leave your contact information as I always do in the show notes, but go ahead and leave your email address and or a relevant website that you would like to steer individuals to. And then maybe also give a shout out. I am a graduate of your amazing Becoming a Neurocriminology Informed Professional. Any other resources that some listeners and viewers might be interested in after this conversation?
Yeah, we offer a number of online trainings through the American Institute for the Advancement of Forensic Studies. Definitely check that out. And Joe, on the last slide that I sent you, my email's there. I would definitely share that with folks. And again, just shoot me an email if you want some links to some articles and recommended readings. More than happy to send that to you. And I can't put an actual number on it, Joe, of how many articles that have been published in the world of Lego bricks out there. But for me personally, over the last several years, I've probably gone through at least a couple hundred empirical based and even web-based articles. For most trainings I do, I stick with empirical based journals, but there's an exception with the Lego stuff. I read everything, blog sites, parenting posts, associations. There's some really neat stuff out there that professionals just have online that talk about how they use Lego bricks. And if I can give just a few thoughts and comments about that, you will find if you go online, there's different organizations, programs out there that have used Legos in dementia care centers, people with multiple sclerosis. They have used it with cancer patients. They've used it with veterans with PTSD. The Lego Foundation, I know, partnered with a group. I don't remember what group. This was really neat to me a few years ago, where they developed these little Lego building MRI machines. And some hospitals around the country are using this for kids who have to go get an MRI, who are very scared of the large MRI machine. They actually have like the nurses and the families sit down with the children and put together that little MRI machine that's built in Legos. And that helps externalize the child's fear. And then the child, after they do that, oh, this isn't so bad. Then they're less afraid to go into the MRI machine. So you can adapt this to so many things. And that was just a small snapshot of how Legos are being used as an educational tool. If you're a college professor or a high school teacher, you will find articles out there in different school programs that have used this in the classroom just to teach skills in robotics and architecture and engineering, and the list goes on and on and on. So it's a great visual 3D tool that can really transform purposeful play into real world application that can really teach these skills to help people of all ages and all developmental functioning levels learn skills that can hopefully help improve decision-making, problem-solving, reasoning, communication, independent living, and the list goes on.
Jerrod, this has been an eye-opening conversation. I'm so glad you suggested this topic for me, and I'm confident that viewers and listeners are going to be appreciative and go down some of those aforementioned empirical studies rabbit holes. Dr. Jerrod Brown, thank you again for joining us here on the Criminologist Podcast. I look forward to our next amazing conversation. Until then, my friend.
Thank you, my friend. Appreciate you. Thanks, everyone.
And that's where we will leave the conversation for today. A huge thank you to Dr. Jerrod Brown for joining us once again and helping us think differently about intervention, responsivity, and the needs of justice-involved individuals. I know Lego-based interventions may sound unexpected at first, but I hope this conversation helped reframe the issue. This is not about toys. It is about engagement. It is about structure. It is about making abstract ideas concrete. It is about creating opportunities to practice communication, problem solving, emotional regulation, perspective taking, and cooperation in a way that is hands-on, accessible, and strength-based. And perhaps most importantly, it reminds us of something central to effective practice. Responsivity matters. If we want people to benefit from interventions, we have to think differently and very carefully about how those interventions are delivered and whether they truly fit the person in front of us. As always, I appreciate Jerrod's ability to take topics that might otherwise be overlooked and help us see their practical relevance for probation, corrections, forensic mental health, and human services. Also, stay tuned to the Criminologist YouTube channel, where I plan to release a video version of this conversation using select slides from Dr. Brown's presentation to help bring some of these concepts to life visually. In the meantime, thank you for listening, thank you for supporting the show, and thank you for being part of the ongoing conversation about better ways to support change. And always remember, folks, there's no them, there's only us.
I'm not saying change what we're doing in the criminal justice system. Continue to do all the great work all of you are doing. But are there some other interventions that we can incorporate into what we're doing that may help the information you're teaching some clients stick more and help that client retain it more?
The Criminologist Podcast is a production of the Paragon Group, LLC. For speaking engagements, training opportunities, program design, or interview requests, visit theparagongroup.llc.com. To learn more about the TIDES supervision model, a trauma-informed, desistance-based approach to community supervision, please visit the TIDESLLC.com. If you enjoyed today's episode, be sure to check out the Criminologist YouTube channel for additional content, including exclusive video interviews and international insights. Both the Criminologist Podcast and the Criminologist channel are brought to you by the Criminologist Media Group. Don't forget to give the show a 5-star review. And as always, thank you for listening.